Do you always call 911 at 3 a.m.?
I'm sorry, but one of our patients need to go to the hospital.
So what seems to be the problem? What's going on with the patient?
Well, one of our patients has shortness of breath and a change in mental status.
Can I have the patient's name?
Well, you see, I'm not the patient's nurse and I just came back from vacation and I don't have any patient history.
Did you take the patient's vitals?
No. I was doing paperwork.
Okay, well, what was the patient's saturation level?
No, I didn't have time.
Did you at least give oxygen to this patient?
Yes, I did. I gave the patient 1 liter of oxygen per minute via non-rebreather mask.
You can't give a patient 1 liter per minute of oxygen via mask. You didn't even connect the oxygen tubing to the O2 regulator. What did you plan on doing? Blow your hot breath through the tube, or is that the CNA's job?
Well, am I?
Is there anyone here who knows what the hell is going on here? Are you the only one in charge?
Well, I'm the only LPN on the floor and the RN is outside smoking, or is on her lunch break.
Let me ask you a question. Does LPN stand for Let's Play Nurse?
Would you like to speak to the RN?
No, I do not want to speak to the registered nut. I guess the EMTs will just have to take the patient, since you cannot take care of the patient yourself.
Well.
Listen to me, Cupcake. Next time you get me out of bed with this BS, make sure the patient is actually sick, or you will be tucking me back into bed. You said the patient had a change of mental status. Is this not the Alzheimer's unit? Did you expect a different presentation?
I'm sorry. To tell you the truth, I scare myself sometimes. I really don't know how to assess a patient. All I know how to do is chart and pass out meds. Sometimes I amaze myself, if I can only do that. Usually the doctor tells me what to do.
How does it feel to be a puppet? Can you do anything without doctor's orders?
I can drain Foley's and change diapers.
Will can at least help us move this 400-pound completely healthy patient over to our skinny stretcher?
Well, I have a bad back.
Tell you what, toolbox, go back to your nursing station and ignore the rest of your patients, and tell Dr. Quack to get his big behind in here and assess his own patients before he sends them out by ambulance at 3 a.m. in the morning, and do us a favor. Don't call us, we'll call you.
I'm okay.